Assalamualaikum warahmatullahi wabarakatuh and good evening to Dr. Sarah Sabe. So today we will present a research proposal with title Factors that Impacting Mental Health of Students. So before we start, let us introduce ourselves. My name is Noina Jiha binti Osman.
My name is Nurul Hanis binti Abdul Halim.
My name is Nabila Najah binti Abu Hassan.
My name is Intan Suraimi Terwali.
So Hanis, could you tell us what is mental health of students?
Yes, so I'll start with the introduction. So mental health issues are the leading impediment to academic success. So in many countries, including Malaysia, poor mental health among university students has become a serious problem. So the pandemic has interrupted the learning of more than 1 billion students around the world. So many universities worldwide have moved to the emergency remote teaching via online platform. So online learning that used by UiTM is ODL, so which is refers to the provision of flexible educational opportunities in terms of access and multiple modes of knowledge acquisition. So a recent view of virus outbreak and pandemics documented stresses such as infection periods, frustration, boredom, inadequate supplies, inadequate information, financial loss, and stigma. It is a hostile experience that can cause mental health issues such as suicide, attempts and depression and many more. So although measures taken to reduce the COVID-19 in Malaysia, such as lockout, strict isolation, social distance, so universities have a significant implication on student mental health, well-being, and anxiety levels. So move to the background research.
Bell?
For the background research, the COVID-19 pandemic affected individuals from all kinds of backgrounds, as people were instructed to self-quarantine in their house to prevent the virus from spreading. The lockdown has major consequences for mental health for each individual, resulting in issues such as frustration, stress, and sadness. Students were not excluded from these issues. This COVID-19 has changed education and students' lifestyle. Since the pandemic was started, Ministry of Health of Malaysia said that 2020 and 2021 were very challenging years, and there was no denying that the people were affected psychologically and emotionally as a result of the COVID-19 pandemic.
For the problem statement, the factors of online distance learning impacting mental health of students is well documented in research and found to be highly related to students' dropout rates, determinations, motivations, and commitment to complete an education online and success rates. The evaluation of impact of student mental health and perceived learning indirectly help educational institutions to identify areas of development and improvement when students experience online distance learning. The purpose of the research is to understand the effects of the pandemic on students' mental health and well-being. For better comprehension on the subject, the study will gather information regarding the factor impacting mental health of students towards online distance learning among UiTM Kedah campus students within online learning environment. Specifically, this study will examine the relationship between online distance learning in the perspective of financial, technology, and environment that affect mental health among UiTM Kedah campus students.
So, as for literature review, there are three factors that impacting mental health of students, which is technology, financial, and environment, as confirmed by Rapanta, Boturi, Goodyear, and also Guardia Cole. The accessibility towards the internet, software, and devices were the important factors for establishing and effecting online learning. Some of families cannot afford their child gadget, and this will affect their learning session, and they cannot catch up with learning in classes. Rural area, which is cyber cafe, closed due to pandemic COVID-19, so they cannot use the computer to continue their learning session. As for financial, According to L.M. Ferrer, financial is one of the root of poor mental health and academic outcomes. There are numerous studies that shows that the advantage of having good time abilities based on the J. Muir University and Students Welfare Organization must teach their students how to manage their time skills to the first students more actively. And the last one is for environment. Some of students had to take care their sibling while in class, or they had to do house chores. Difficulty with friends, roommates, or romantic partner have all been related to an increase in mental health issue by J. Duarte. This is also one of the effects that can cause students to their mental health. So move to the next one.
So for the methodology, the population of the study are students from UiTM Kedah, which is comprises about 7,000 people. So the sample size of the study will be 60 respondent is selected because according to the Umar Sekaran and Raji Bugi, to obtain a normal distribution is 30 people is selected is sufficient. So this research also use convenient sampling to obtain respondent. For the data collection method, data for this study is using questionnaire formulated by the researcher by the refer to the past study. So the researchers use dichotomous scale that requires an individual to agree or disagree with the statement or respond to a single question because the literature of this research is descriptive research. For the data analysis procedure, the data for this survey is using frequency analysis for all questions. The study of quantitatively describing the characteristic of set of data is called descriptive statistic. So
Next,
move to
please.
the next presenter.
Okay, for the finding, this table will show the dependent variable, which is student mental health involved in this study. From the result of 59 respondents from students of UiTM Kedah, it shows that only 6 students had diagnosed with mental health before online distance learning, while 53 students diagnosed with mental health. The result also shows 42 students have experienced emotional problems such as anxious or depressed that affecting daily life due to online distance learning, while only 17 do not have this problem. Next, this study also investigates mental health rate among students, which can be divided into 5 categories, which are excellent, somewhat good, average, somewhat poor, and poor. There are only 2 students have excellent mental health. 9 students, somewhat good, 26 students have average mental health, 17 somewhat poor, and only 5 students have poor mental health. Next. In this study, the researcher identifies 3 independent variables from these issues, which are environment, technology, and financial issues. This table will present environment factor of this study. Based on the result, 50 students have distraction at home, such as taking care of sibling, do some chores, and etc. Meanwhile, only 9 students does not have problem with this. That does not have this problem. Furthermore, 53 students have lack motivation during online learning, while only 6 students have motivation while doing online distance learning. Lastly, 52 students had distracted by social media, internet, and video games in online distance learning, while 7 students did not distracted. Next, for technology factor, firstly, there are 31 students have internet connection problem and 28 students do not have internet connection problems. Next, 41 students have an updated interactive learning gadget while only 18 students do not have an updated interactive learning gadget while performing online distance learning in this pandemic of COVID-19. And last but not least, in terms of technological knowledge, 26 students do not have enough knowledge about the use of some application, while 33 students do have enough technological knowledge. Next. And last variable of this study is financial factor. This table which shows that 14 students affected by the financial situation of the family, while 45 students do not have problem with financial situation. 41 students do not have difficulties in paying internet bills, while only 18 students having difficulty in paying internet bills in online distance learning. And lastly, 33 students have difficulty managing their own financial flow, but only 26 students do not have difficulty in managing their own financial problem while facing online distance learning in this pandemic.
So as for the discussion, 88.14% of students are distracted by social media. This is because due to the fact that they prefer to spend their time online socializing and making friends on social networking sites rather than reading books. And also the second one is internet connection problem do not have an updated interactive learning gadget and do not have enough technological knowledge, and the use of some application are the things that make students mental health unstable each day. This is based on M. Owosu Acho 2012. As a result, it is crucial to figure out how much time students spend on social media sites and how much of that time is spent on social media site for academic objective. And the last one is financial problems can affect students' mental health either. Financial situation of the family, having difficulty paying internet bills and difficulty managing on their own financial flow is one of the things that affecting mental health of student that have been said in findings before. So the last one is conclusion. We move to Bell.
In conclusion, the factors of online distance learning are impacting mental health students. Students may feel socially disconnected, may lack mental health resources and support, and may experience academic stress. This sense of isolation is problematic as it impacts the overall mental health of the students, resulting in negative psychology outcomes. The impact of ODL on mental health students is not only in the computing environment but also the support system and the curriculum design. This paper argues that social network should be considered when designing online educational curriculum and provide practical strategies to improve student academic performance. Thank you.
So that's all for today. Thank you for listening to our presentation. I hope you guys have a nice day and thank you so much. Assalamualaikum warahmatullahi wabarakatuh. Bye bye.